Hello, I'm Laura Morgan, and I'm excited to share with you some of my observations from being on both sides of the speech pathologist's table in treating challenges that often accompany brain injury. In this brief presentation, first I'll tell you some of my background, then I'll explain my brain injury and recovery over the last 7 years. And throughout and in closing, I'll share a few of the other clinical applications I've gained from sitting on the other side of the speech pathology table. Applications which daily influence my current speech pathology treatment for adults with brain injuries and may provide new thoughts for you as well. Throughout this talk, I'll refer to people who have experienced traumatic or acquired brain injuries simply as survivors. To give you some background, after attending the University of Tennessee to earn my master's in speech pathology with a concentration in oral habilitation, I moved back home to Maryland and accepted a clinical fellowship in a long-term care and rehabilitation facility. It was there that I met one of my dearest friends, Anna, who was also starting her clinical fellowship year in speech pathology. We became fast friends, and through each other, processed much of what we were learning in our clinical fellowship year, and throughout the life-changing event that was about to occur. I had completed about 4.5 months of my 9-month clinical fellowship, so was exactly halfway through when my grandmother died. We were in the Lynchburg, Virginia area when the van we were in drifted off the road and slammed into an 18-wheeler semi-truck. This picture was taken by a news crew. I had sustained a moderate to severe diffuse axonal traumatic brain injury and broke some bones, including my jaw and spinal vertebrae C1 and C2. I was stabilized at a local hospital, then helivaced to a larger hospital where I remained until being transferred to a third hospital to begin rehabilitation. The right side of my head was injured, so the opposite, left side of my body has been most affected. With excellent care and family support, I returned fairly quickly to speaking and also eating by mouth. Oops. At one point, the speech pathologists were reviewing a swallow study that had been performed on me. My dysphagia knowledge must have gone on autopilot because I was accurately interpreting out loud what I saw on the screen. And also, here's a little brain injury humor for you. At some point, a rehab therapist asked me if I have any pets at home. I had a dog and a cat at the time, but I replied, "Oh yeah, I've got lots of animals, baby lambs, dogs, and I'm a big-time duck feeder." Of all the cool occupations to dream up and brag about, feeding ducks. But the ducks bring me to an interesting point. Let's discuss confabulations. Just to review, confabulations are the crazy and often humorous attempts of the brain to make sense of a situation without the conscious intention to deceive. My crazy occupation as a duck feeder is an example of a confabulation. So here's a takeaway for you. Don't assume a survivor's crazy story is indicative of them being crazy. There might be bits of truth in there, but the main thing confabulations indicate are a brain working overtime to try and make sense out of an unbelievable situation. I was inpatient at 3 hospitals for a total of 72 days, of which I have absolutely no memory. Then I was transferred home. After finishing therapies with some fabulous in-home clinicians, I completed several years of outpatient therapies. Still, there were and are numerous challenges for me, like having poor short-term memory, which I accept I probably will need to compensate for the rest of my life. And prior to the accident, I was an accomplished cello player and also found great meaning and fun in jamming with others on my banjo. I had to go through a grieving process for my previous musical abilities before I could even consider other instruments that my left hand could manage. And remember that clinical fellowship I was halfway through when the accident occurred? Well, when I was finally ready to return to clinical work, not only had my praxis scores expired, but it was determined that I had to repeat my entire clinical fellowship. Well, determination comes in and I passed the praxis again. There were several great disappointments in finding a clinical fellowship, but now I am very grateful to have been given the opportunity to not only earn my C's at the Head Injury Rehabilitation and Referral Services, HERS, in Rockville, Maryland, but also earn a certification as a brain injury specialist. Now, I'm given the chance to come alongside other adult brain injury survivors to hopefully encourage them and guide them in their own recoveries. I think it's important that as rehab therapists or caregivers, we recognize the huge losses survivors are enduring after brain injuries. While respecting the survivors' individual preferences and personalities, we can model for them how to acknowledge their grief, celebrate their victories, and use compensatory strategies to increase their successful independence. To force my own very determined self to acknowledge a goal being reached, rather than just moving on to the next objective and depriving myself of a valuable chance for encouragement, I formed what I called a journal of successes. In that journal, I recorded any accomplishment, including those that I would have been too embarrassed to mention as being noteworthy to other people, like the first time I was able to pull my hair back into a ponytail or remember a new address. The grief over losses was still very raw during the early days of my recovery, but other ways I found meaning in that time were through participating in research studies on brain injury at the nearby National Institutes of Health, NIH, and in volunteering. I logged over 400 hours volunteering for 2 wonderful speech pathology departments, which not only provided me functional cognitive stimulation, but also served as a way to refresh my speech pathology terminology. Meanwhile, my friend Anna and I were still compiling our lessons learned from my injury and recovery. We decided to submit an article to the ASHA Leader, which was published in their December 2015 issue. You're welcome to look it up online. You can just Google the title. Okay, now I want to very briefly summarize for you a few additional things I learned while being a recipient of speech pathology services. One was that, unlike many physical goals, cognitive progress is difficult to track and doesn't always respond to willpower. Also, if a survivor has memory deficits, as I did and do, the strategies can't be recalled until they become habit out of repetition. So, in my experience, cognitive challenges could feel like banging my head against a wall over and over. My eyes have also been opened to how the environment may impact a patient's performance, a survivor's performance. It would be perfectly natural to set up decorations in your own work office that remind you of favorite pastimes and achievements. But If you want to support a survivor's attention, motivation, and performance on a task, first put yourself in their shoes. As a patient myself, I found myself emotionally pulling away from a clinician in the therapy session, for example, after seeing pictures up in their office of them doing exciting outdoor adventures with friends, an activity I'd normally love to be doing, except I physically couldn't due to the accident. Try to be respectful of survivors' grieving process, so consider what you want to accomplish through your office decorations. It would have meant so much to me to have a therapist sacrifice a few minutes from the session to ask me about my own personal interests and goals. I know such questions might lead to tears, thus be a hindrance to productivity expectations. But why not ask a quick, fun, get-to-know-you question at the start of your session? Family members and many survivors, I was totally one of them, will likely press for your believed expectations of their outcome. But a word of caution, since you really can't know for sure a survivor's long-term outcome and how their recovery will unfold, don't be pressured into expressing negative expectations prematurely. Research has shown the value of leaving room for hope. Remember that if a survivor is dealing with memory loss, they will likely leave your session recalling only what was most impactful, which can easily be the most discouraging moments. So, how is the clinician to combine these two stances of realism and optimism? I think we should support the patient forming high-achieving goals. Don't discourage those, especially in the early stages of recovery. But help them form a realistic, healthy understanding of the challenges experienced during any challenge by any individual. There is one more thing I'll mention as something to be aware of when treating brain injury. Only as the problem solving and memory start returning to normal can a survivor start recognizing their deficits and all of the uncertainties surrounding their situation. When I was first experiencing this dichotomous pairing of great progress with difficult new levels of grief, I started referring to it as the double-edged sword of cognitive progress. So you may pick up on new levels of grief in your survivor at the same time as what you, the therapist or a family member, perceive as wonderful gains in progress. You don't work through a loss once. Life experiences will cause a loss to resurface, needing to be addressed again, though the impact will usually diminish over time. Having an atmosphere of open dialogue will help survivors view the therapist and themselves as being on the same team. Hopefully, we are the experts on the specifics of the recovery process for the given area, but the survivor is an expert on what will motivate or discourage them individually. As cheesy as this sounds, I believe both the patient and the clinician experts are essential for reaching the goals and achieving success for the survivor. Although I couldn't make room for questions now, I'd love to have a dialogue with any of you over email. And there is my email. Thank you.